Alrighty, let's do chapter 16. We're going to be talking about reassessment. Reassessment is the last step in the patient assessment, but it's a very important step, and we're constantly reassessing. So let's go ahead and get into this. We're going to talk about reassessment. Okay, reassessment. We're going to repeat key elements of the assessment process that we've already performed. So we're not going to do anything new. We're just repeating steps. We use this to identify changes and trends. And you never skip except when life-saving interventions are needed. So again, if you have a really critical patient, you may never get past the primary assessment. So you may never get into this reassessment step. So that's important to note. Reassessment identifies changes that may be subtle or obvious, right? You may miss these subtle changes if you didn't reassess your patient, or it could be definitely obvious. We use it to trend, so we reassess to make sure that our patient's getting better, make sure it's not getting worse, make sure that our interventions are working. If not, then we need to change our plan. Deterioration or improvement. So that's what trending's for. Communicating with the patient. We'll explain the process. Consider the patient's feeling, such as anxiety or embarrassment. So we're going to explain that we're retaking vitals and we're reassessing them. So, but remember, some patients are very anxious and they may be embarrassed about this whole process. What are the components of the reassessment? First of all, we're going to start. It starts with the primary assessment. We're going to recheck for life-threatening problems. We're going to recheck their mental status. Make sure they have an open airway. We're going to make sure they're breathing. We're going to monitor that for the rate and quality. We're going to do the same for the pulse. Make sure we have a pulse, and we're going to monitor the rate and quality. We're going to constantly monitor the skin tone or color, and temperature. And we're going to reestablish patient priority. So remember, we talked about in the primary assessment chapter that sometimes these priorities can change. Maybe it was a stable patient. Now, for some reason, it's become unstable, or vice versa. Maybe it started off as an unstable patient, and because of the interventions we've done, now the patient is more stabilized or more stable. The mental status of an unresponsive child or infant can be checked by shouting, right? Verbal. Like if they're unresponsive, we yell at them, "Hey, you," and they open their eyes. Or we flick their foot, painful stimuli. Crying is an expected response from a child with an adequate mental status. So they're upset, they're going to cry. And the younger they are, maybe crying, like if they're below a year, maybe crying is the only way they have to communicate anyway. We're going to reassess and record our vital signs. And we're going to compare to these baselines. That's called trending, right? So we talked about earlier, critical patient gets vital signs every 5 minutes or less. And a stable or uncritical patient gets them every 15 minutes or so. With this, we're going to reevaluate their oxygen saturation. We consider that a vital sign in our region, so we're going to do that anyway. And then we're going to document the findings so we can identify trends. We're going to repeat the pertinent parts of the history and physical exam, right? So we're going to re-examine that chief complaint. Maybe it changed, especially in regard to severity. Maybe it's gotten worse or it's gotten better. We're going to ask about changes in symptoms. And we're going to repeat the physical exam. And remember, in a responsive patient, medical patient, we're going to focus on the area that they're talking about. For example, if we have chest pain, we're going to focus on their cardiovascular or respiratory systems. Trauma, we're going to focus on the injured site, like my ankle hurts. So we'll go reassess that. Unresponsive patients get a head to toe regardless, either medical or trauma. Check our interventions. We're going to make sure that everything's working, that our oxygen is delivered and on our artificial ventilations. We're going to ensure that we manage the bleeding if they're bleeding. And we're going to ensure adequacy of other interventions. So we're going to make sure what we're doing is working. And if it's not, we're going to change our plan to accommodate that. Here you see he's checking interventions. He's making sure that that wrist is still, it looks like that's probably a wound. So he's got the wound covered. Maybe it's a cut. He's making sure it's not bleeding through the dressings. And he's probably checking for PMS as well, distally. He wants to make sure she has a pulse, motor, and sensation. Observing trends. This is repeating assessment steps frequently. We talked about how often we're going to reassess. We'll notice and document these trends. And the term trending means changes in the patient's condition over time. And we've talked about this. Trends may indicate that we need to change our treatment plan or adjust our ongoing treatment. Maybe it's not working and we need to change it, or maybe it is working, but we need to put more effort into it to make it better. Here he's reassessing and recording vital signs. Reassessment for stable and unstable. Remember that a patient's stability can change. It can either get worse or better. The more serious patient's condition, the more often you will reassess. We talked about this, right? Unstable patients every 5, stable 15. We went through this. And if you believe that there has been a change in the patient's condition, we repeat at least the primary assessment to make sure they've not developed any new life threats that we need to fix. Chapter review. This is a short chapter. Reassessment is the last step of your patient assessment. You should generally reassess a stable patient at least every 15, unstable every 5. Elements of reassessment will include repeating the primary assessment, repeating and recording vital signs, repeating pertinent parts of the history and physical exam, and checking any treatment or interventions you perform for the patient. So it starts at the primary and works its way down, right? So it'll go all through the primary. We'll do pertinent parts of the history and physical exam, and then we'll check it for interventions to make sure what we're doing is working. Because there's no sense continuing to do something if it's not going to work. Treatments you need to check include oxygen bleeding, spinal motion restriction, and splints. Reassessment is vital for not noticing changes in your patient. This is called trending. Trending can help determine if the patient is improving or deteriorating, right? So if we just did our initial assessment and never checked our patient again, we would never know if the patient's getting worse, patient getting better. If what we gave them, for example, we gave them a nitro, is it helping? None of that. We'll never know that unless we trend or reassess. Reassess frequently and record new assessed data. All right, that'll do it for this chapter. We will see you on chapter 17.